This case study is about New York City, who through understanding where their community is most vulnerable have been able to make smart decisions around implementing their heat management strategies. A key focus area of Sydney's Environmental Action Plan is Climate Resilient City. One of the top priorities within that focus area is to develop a heatwave response plan. Developing heatwave response plans are a low-cost way for cities to improve their resiliency through climate change adaptation and preparedness. In one US city, implementing a heatwave response plan was a cost to the city of $210,000. However, generated up to $468 million in cost savings over 3 years. During extreme heat events, some groups of people such as seniors, children, and those with chronic illnesses are the most likely to suffer. Response plans must ensure they can address these groups of people as they are the most vulnerable. More people die from extreme heat in New York than from any other weather event. Between 2000 to 2012, there were 162 heat-related deaths. To combat extreme heat, there have been several successful initiatives to date. Cool Roofs NYC, which through painting inner-city roofs white, has saved 2,280 tonnes of CO2 through improved cooling cost efficiency of buildings. Most recently released is the Cool Neighbourhoods program, a $106 million investment that extends resiliency activities from the CBD districts into the broader boroughs of New York. To ensure the city's efforts are focused on the areas in New York that need help most, the city developed a Heat Vulnerability Index in collaboration with the University of Columbia and the New York Department of Health and Mental Hygiene. They reviewed mortality information over an 11-year period, reviewing the relationship of heat waves and deaths. Data collected included environment data, made up of daytime summer surface temperature and green tree cover, as well as social data, which includes poverty and race. Findings in the data showed individuals were more likely to die at home. This could also be related to social isolation and lack of mobility, both of which have previously been linked to heat-related death. Those living in green areas were less likely to die. Green areas are often found in higher socio-economic areas. To display everything on a map, a composite index was created with inputs such as areas with public housing, surface temperature, and the number of trees. So what was the outcome? Implementing the HVI has provided the New York City stakeholders with a measured way to distribute the resources for the Cool Neighborhoods initiative to the people who need it most. For example, the map on the left shows green infrastructure projects, which correlates to the vulnerability map on the right. One example of the projects coming up is Be a Buddy, that will increase the number of neighborhood volunteers by creating a buddy system. These buddies will be activated during emergencies, calling and doing face-to-face checkups on vulnerable people in the city. The city is also launching an innovative data collection program that will be able to collect more accurate information around extreme heat weather events. These include LiDAR maps and neighborhood-level temperature collections. While it's too early for results on the Cool Neighborhood program, the success of HVIs and heat response plans specifically have been quantified in other studies. Philadelphia was the first city in the US to implement a heat warning system, and it was shown to have saved over $468 million in the first 3 years after implementation. In Australia, the NCCRF has completed a national heat vulnerability study across all capital cities. This study would be a really useful starting point for the City of Sydney. Additionally, local government areas like Parramatta have done their own basic heat mapping, as can be seen on the Cool Parramatta website. As noted in the HVI research, there is an opportunity to improve the index measures by improving the data inputs. These additional inputs could include more information around comorbidities and their impact, individual data on socio-economic status rather than postcode level data, and including cooling data such as access to air conditioning at home. This could be fed into future studies to improve HVI accuracy. And that about wraps it up. Thanks a lot for listening.